This is the fibrous tunic. So tunic or layer, you only have three choices: fibrous, vascular versus neural. As soon as you see these blood vessels, identify the specific covering. So if I just said identify the specific structure, this is the white of the eye. This is called the sclera. So the white of the eye is the sclera. All of this is your fibrous tunic. But then the covering, where we tend to get pink eye or red eye, or when our eyes are tired, we get that vasodilation here. This covering of the sclera is our bulbar conjunctiva. Nice job. So at this point, conjunctiva on the bulbar conjunctiva. So our fibrous tunic, we have our sclera, again maintains the shape of the eye, protection. The bulbar conjunctiva, we pull off this fibrous tunic. Identify this tunic. Vascular tunic. Identify the specific structure. Choroid. Nice job. Did you catch that? So tunic is the layer, fibrous, vascular, or nervous. Specific structure, well, most of the fibrous tunic is your sclera. Most of the vascular tunic is your choroid. Two functions of the choroid.
Increase nourishes retina and absorbs light.
Excellent. Nourishes retina, absorbs light, and nice short-term memories, because that's tough to learn. This specific part we would call the iris. It controls the amount of light entering the eyeball through this opening called the pupil. Ooh, we open this up. Oh, look at these cool little structures. You can barely make out the ora serrata. It's not gorgeous, but this is showing you where those ciliary bodies are. And what are these interesting linear structures representing? Ciliary processes. These are what produce that aqueous humor or aqueous humor. Well, if we pull out this vitreous humor, which we'll talk about in a sec, oh, look what was labeled on a previous lab exam. We have two circular structures back here. So one in white and then one in not white. One has all the blood vessels coming in and out. The other does not have the blood vessels coming in and out. So this circle with all the blood vessels and axons has no photoreceptors. What would number 41 be?
Optic disc.
The optic disc. Nice job. Sometimes we call that our blind spot. Versus over here, this large circle is the macula lutea, and that center point we call the fovea centralis. Excellent job. Well, if we're kind of getting those layers down, let's add just one more piece to the puzzle, and that is, if we look at the bottom of the page on 177, it says we also need to know our cavities. So I already mentioned the lens, this cavity to the front or anterior to our lens. I'm going to fill it with blue. So all of this cavity in front of the lens, this is what we call our anterior cavity. But we can get even more specific than that, because the anterior cavity has different chambers. There's a chamber in front of the iris and a chamber behind the iris. So as we start looking at these regions, number 17, for instance, is a chamber of the cavity. So number 17, if we gave the whole answer, we would say this is the posterior chamber of the anterior cavity. So the anterior cavity is the entire cavity in front of the lens. But then the anterior cavity is divided into two chambers by our iris. So if we look just at between basically the lens and the iris, this little chamber, posterior chamber of the anterior cavity. In front of that area, anterior chamber of the anterior cavity.